Good morning, doctors. Welcome again. Today we are going to discuss about an ovarian cyst. Lot of myths regarding this ovarian cyst in brain of gynecologist and some youngster doctors also. Firstly, I want to say what is an ovarian cyst. Even I have such case of ovarian cyst, that is functional cyst in my patient, and I will tell you a little story when she visit a gynecologist what happens next. Okay, an ovarian cyst is any collection of fluid surrounded by a very thin wall within a ovary is known as ovarian cyst. That is larger than 2 centimeter is termed as ovarian cyst. So hope you understand, collection of fluids surrounded by a very thin wall and it is more than 2 centimeter is termed as ovarian cyst. And ovarian cyst can be as small or large. Most cysts are functional in nature and harmless, benign. Ovarian cysts are found in nearly all premenopausal women and in postmenopausal women. So hope till here it's clear. Now this is normal ovary and that one is ovary with cyst. Okay, now types of ovarian cyst: functional cyst, that is normal and most common in my patient. She is functional cyst, on USG it's visible. And follicular cyst, corpus luteum cyst, and PCOD. We will discuss individually all these. In my case, which I treat functional cyst, I will explain you there. So see, firstly, functional cyst is the most common type of cyst. During the menstrual cycle, the ovaries form tiny sac cyst to hold the oocytes. Once the oocyte matures, the sac breaks to release the oocyte and then disappears. May be the cause of abdominal, and in this case of functional cyst, this oocyte matures but not able to break or release the oocyte or disappear. That's why the cyst appear. So this is a functional cyst and may be the cause of abdominal heaviness and pain female experience during menstruation. In my patient, there is a minor pain, abdominal lower. Functional cysts are usually harmless. This cyst is harmless, and she is. I am just assure that patient that no need to do nothing, only wait and watch. This is harmless cyst. It rarely causes pain and often disappears within 2 or 3 menstrual cycles. So I also decide that this cyst will disappear and I need to wait. But due to some reason, I'm out of station and that patient visit to a gynecologist. And she told her this is very dangerous cyst. It is cancerous cyst. So guys, I will tell you, these functional cysts are not dangerous and not cancerous. This is harmless, and the patient is afraid after that, and she told me the whole story about that doctor. So I told her I am going to make video on this functional cyst, you can watch, and this lecture I will send her. After that she will watch. So functional cyst rarely need treatment, it disappears its own. There is no any medication which disappear this functional cyst, but this is disappears on its own. In very rare case we require surgery, and no need to afraid if someone has suffering from some functional cyst. Need to wait and watch as I do in that case. Cyst PCOS. Between 1 in 10 of childbearing age has PCOS. It can occur in girls as young as 11 years old. How many women have PCOS? Very common hormonal problems of teens and females of reproductive age group 15 to 49. Every 10th woman of childbearing age has PCOS. It can occur in a girls as young as 11 to 12 years old. Now dermoid cyst, even I saw dermoid cyst case also, but that cyst is too much large, filled with hairs, and we remove that cyst by the help of laparoscopy. These are ovarian cysts that are filled with various types of tissue, including hair, skin, or tooth sometime. Okay, now endometrioma cyst and endometrioid cyst, endometrial cyst, or chocolate cyst is caused by endometriosis and formed when a tiny patch of endometrial tissue bleeds, sloughs, of become transplanted and grows and enlarge inside the ovaries. Okay. So what are the signs and symptoms? But these are rare with ovarian cyst. Most of the women without having any symptoms we diagnose clinically or sometime USG we identify. Abdominal bloating or swelling, painful bowel movements, pelvic pain before or during the menstrual cycle, painful intercourse, pain in the lower back or thighs, breast tenderness, nausea and vomiting. Okay, now physiological cyst. This group includes the follicular corpus luteal and luteal luteal cyst. When it is less than 5 centimeter, have thin wall or well encapsulated, unilocular and contain clear fluid. Follicular cyst. Okay, follicular we can say functional. Result from unruptured Graafian follicle, failure of atresia in non-dominant follicle. Shelter more than 5 centimeter may achieve up to 10 centimeter. Thin wall plus well encapsulated may resolve spontaneously. Follow up every 3 months. USG guided aspiration or we can do laparoscopy. Corpus luteum cyst, progesterone PROD. What is corpus luteum cyst? Occurs when corpus luteum cyst became ruptured or bleeding occurs into subsequently fails to regress. Size similar to follicular cyst and usually regress with time. Patient can present with acute abdomen if bleeding occurs and the cyst rupture. Treatment analgesia or surgery. In corpus luteum cyst what happened? In follicular cyst what happened? What was the difference between them? In follicular cyst, when the ova mature and it is not able to come outside and it converts into a cyst. But in corpus luteum, the ova matures and travel through a fallopian tube. But after that, the cyst develops. This is known as corpus luteal cyst. Theca luteal cyst associated with multiple pregnancy, most resolve spontaneously. So these cysts need to wait and watch for 2, 3, 4 menstrual cycles and this will resolve on its own. No need any surgical intervention and no need to be afraid. Don't be hyper when you see such case in your OPD. Okay, now how to diagnose? First step, ovarian or non-ovarian, you have to rule out. USG pattern recognition, you have to recognize simple cyst, hemorrhagic, endometrioma, mature cystic teratoma or any other cyst possibly malignant. If it is malignant, you have to be worried. If no malignancy, you rule out clinically, that means no need to worry. Step 3, low risk or high risk, follow up with us. Evaluation with MR or surgery. Now, diagnosis. Ovarian cysts are usually diagnosed either by ultrasound or CT scan. Treatment, about 95% of ovarian cysts are benign. So, ovarian cysts are 95% benign, but in case of young adult, young females, these are mostly benign, meaning they are not cancerous. Benign means no cancer, no cancer. Treatment of cyst depend on the size of cyst and symptoms. For small asymptomatic cyst, wait and watch. See the approach with regular checkups will most always likely recommended. Pain caused by ovary cyst may be treated with pain relievers as I do. If she found some little pain, I ask take Meftal SOS. Acetaminophen, paracetamol, non-steroidal anti-inflammatory drugs, ibuprofen, narcotic pain medications may help reduce pelvic pain. NSAID usually work best when taken at the first sign of the pain. Okay, now about 95% of ovarian cysts are benign, meaning they are not cancerous. Treatment for cyst depends on the size of cyst, type of cyst, what symptoms she experiences, the woman age, general health, her future pregnancy plans, small asymptomatic cyst, regular monitoring. Now, surgical management, laparoscopy. The laparoscopic approach should be reserved for those women who are not eligible for conservative management but still have a relatively low risk of malignancy. The appropriate laparoscopic treatment should involve Oophorectomy, usually bilateral rather than cystectomy, with removal of ovary intact in a bag without cyst rupture into the peritoneal cavity. Hemorrhagic ovarian cyst follow up, formed because of occurrence of bleeding into a follicular or corpus luteum cyst. If cyst is less than 5 cm, do not need follow up. If cyst is more than 5 cm, short interval follow up 6 to 12 weeks, with US recommended on ensure resolution. Benign cystic teratoma or dermoid cyst management. Dermoid cyst, especially smaller than 6 cm, can be followed conservatively. Followed with us at Followed with us at an initial interval of between 6 months and 1 year, regardless of age, if they are not removed. So guys, have a good day. Goodbye. That's all for today. If you have any queries, any question regarding this, you can ask me. And if you still not subscribe my channel, please subscribe it. And if you like this video, please put like on it. And never be afraid with any kind of disease. No need to cry. Always be in a good hands. And everything, we have treatment in our hands, so we will treat it. So no need to worry. Thank you. Good day and goodbye. That's all for today. If you like this video, put like on it. These all are evidence based I shown you here. And hope, if you still not subscribe my channel, please subscribe it if you are a new subscriber. And if you like this video, put like on it. Thank you. Good day and goodbye. If you have any queries, question, you can ask me.